Hello everyone, my name is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis, and in today's video I'm going to go over 3 keys to reversing your type 2 diabetes. Yes, I said reversing type 2 diabetes. We have many patients that come to our office because they no longer want to manage diabetes, they no longer want to control diabetes, they actually want to reverse type 2 diabetes. And what I'm talking about when I talk about reversing diabetes, I'm talking about reducing and eliminating the need for medications. We're seeing the numbers come down. We're seeing blood sugar, blood pressure, cholesterol, so all those numbers are coming down. And we're seeing a patient losing weight, many times without even exercising. We're seeing energy restored. We're seeing they're sleeping better. And I think the biggest thing is the patient now feels like they're in control of their health. So that's what I mean when I'm talking about reversing type 2 diabetes. And now I want to go over the 3 keys that I think are essential to you reversing your type 2 diabetes. Now once again, don't change any of your medications without doctor supervision, of course, and this is just for educational purposes. So now let's get into the top 3 keys that are essential for you to reversing your type 2 diabetes. Alright guys, so let's get into the 3 keys for reversing your diabetes. So the first key is knowledge. And we've all heard the saying knowledge is power, which I'd agree with, but I think more appropriately and more effectively, it's the right knowledge is power. And that's what you need, is you need the right knowledge in order to reverse your type 2 diabetes. So I would want you to become more aware of where you're getting your advice from. Many of the patients that come in to see me, they've gotten a lot of advice by the time they get in to see me. They've been to many doctors, they've been to educators, they've been to nutritionists, they've been told a lot of things. They've been on the internet, they've read books, and they get all of this advice. Now, one of the key things to advice is you have to be careful really who you're taking advice from. And one of the things that I do is if I'm taking advice from somebody and I want a certain result and they're telling me they can get that result, my next question is, well, where are their statistics in achieving that result, my desired result? So for example, if I wanted, say my house remodeled and I called on remodelers in the area, I could then get some names of their clients and I could call those clients and find out how well they did. Did they achieve the result that the client wanted? And I would stress this with you as well when you're looking for a healthcare provider. So number 1, you need to know what result you want, but then you need to ask the provider, well, do they think they can provide that result for you? Number 2 is we need to treat causes if we're going to reverse type 2 diabetes. We cannot treat symptoms. That's what most patients are getting when they come into my office. They're getting symptom care. And we don't want to treat symptoms. If we treat symptoms, we're just putting a Band-Aid on this problem. And so we have to actually get down to the root of what's causing it. And what I mean by that, if I have 100 diabetics come into my office, they're going to have, what they have in common is high sugars. But the reason why they have high sugars, it's different from person to person. So we have to look at each individual and we have to say, okay, what are the causes of your high sugars? What are the causes of your high blood pressure? What are the causes of your high cholesterol? What is going on inside the body that we need to fix so that you can now function at an optimal level? So we want to not treat symptoms. We don't want to just cover up the problem. We want to actually treat the root causes. And that's an essential key if you want to reverse your type 2 diabetes. Number 3 is you need an individualized, personalized care plan that's going to be tailored for your body. You've been through unique experiences over the past several decades in your life, very unique to you. You have a certain genetic makeup. You have certain physiological issues that are going on within you that are unique to you. So those things have to be addressed. Those items, those dysfunctions have to be addressed so that we can get you functioning optimally. it's not going to work if we just throw a cookie cutter program at you, or maybe it'll have marginal results. But I can tell you in our office, we don't have one nutrition plan that's going to be right for every patient. We do not have one supplement plan that's going to be right for every patient. We have to look at, and number one, we got to make the right diagnosis. So we have to look at what's causing it. Once we know what's causing it, then we can put together a personalized, individualized plan that's going to be mapped out and tailored exactly for what that person's body needs. And those are the three keys, guys. You got to have the right knowledge, you got to treat the root causes, and you need an individualized care plan that's going to be tailored for you. If you got something, got some good information from this video, make sure you like it below. Also subscribe to our channel. And if you have a question, if you have any type of concern, something you want me to address in a future video, also leave that below in the comments section and we'll get to that. Also look for my upcoming video. I'm going to do a video that's going to talk more about this individualized care that we provide in our office versus a conventional care model. So look for that in future videos. We'll see you then, guys.